Welcome to the Tech Talks Daily Podcast, where you can learn and be inspired by real-world examples of how technology is transforming businesses and reshaping industries in a language everyone can understand. Here is your host, Neil C. Hughes.
Welcome back to the Tech Talks Daily Podcast. Now, as you all know, I'm passionate about all things technology, but only when it works. In today's interview, we did have to switch back to some old school tech and a home telephone handset. But you know what? We made it work. And also highlighted to me that we shouldn't rush in and remove that home handset because it does still have a use. And I'm so glad that we did because I love chatting with him today. And I feel like I've made a new friend, and his name is Bird Blitch. Not only does he have an incredibly cool name and the kind of guy that can easily get on page one of Google, but he's also the CEO of a company called Patientco, where he works with an incredible team on an important mission. And that mission is helping health systems understand the patient payments are actually an economic growth engine. So on today's episode, Bird will help me understand the US health system and also the problems that they set out to solve using technology. In a nutshell, Bird is an entrepreneur with a fantastic story to share with us all today. So buckle up and hold on tight so I can beam your ears all the way to Atlanta so we can speak with Bird Blitch from Patientco. So a massive warm welcome to the show. Can you tell the listeners a little about who you are and what you do?
Sure. Neil, it's great to be with you today. My name is Bird Blitch, and I am the co-founder and CEO of a company called Patientco. We are, if you think about payments, everyone, money's got to move. We're a payments technology company that is really focused on healthcare. And so our goal is to really, from a healthcare perspective, be the leading patient financial navigation technology that empowers patients around things like transparency, understanding and controlling those costs in the U.S. health system. And so I'm sure we'll get into some of that today and how it differs maybe with the daily lives that everyone leads inside the health system, inside the UK. But there's some different aspects to the problems we face here, and I'm sure you've read about them a lot. And those problems create opportunities for entrepreneurs to solve.
They really do. And before we get started, the first thing I've got to say is what a cool name, Bird Blitch. It's almost like you should have been an action movie star. Do you ever feel that way?
Well, if you see me, you would know I'm no action movie star, but I am named after my grandfather, whose middle name was Bird. He was, I live in Atlanta, but my grandfather was from South Georgia. He was what they call an old country doctor, and he was called Dr. Bird. He had 3 girls, and the oldest girl was my mother, so she named me after my grandfather, and of course the surname comes along with it, so Bird Blitch. And I'll tell you a little quick trivia question on this. I went to Georgia Tech, the Georgia Institute of Technology here, for an engineering degree, and I ran for student body president. It's my first and only time into what I'll call the public life of running for office. And as a student there, my campaign slogan was, "When life at Tech is a blitch, give them the bird." And I lost the election, but I think people certainly remembered my name on the ballot.
Absolutely love that. Great story. Now, as someone based in the UK, I am a little unsure of the scale of the problem that you set out to solve. So can you just tell me a little bit more about the problem with billing in the healthcare industry and the kind of problems that you're solving by leveraging technology?
So let me talk about the problem first, and then we'll talk about leveraging the technology. The problem is unique here because there's a certain amount of dollars that are required for, let's just call it a visit to the doctor or a surgery. And here, there's different buckets on how that gets paid. It could be the public insurance company, which is Medicare, Medicaid, right? It can be the private insurance company, which is, you may have heard names like Blue Cross Blue Shield, Humana, Aetna, or you can choose to not have any insurance and pay it yourself, and that's called true self-pay. Through President Obama, he created a bill that basically made it mandatory for everyone to have some sort of insurance because the costs of healthcare here were going exponentially high that people couldn't afford it. And so at least the insurance was more of a, if you had something really bad happen, you could cover that. If you choose to not want to pay for, where the premiums varied in size and structure. So my next answer to your question is, you created things like deductibles. And a deductible, here for healthcare is I can have a $5,000 deductible, which means I have to come out of pocket $5,000 before insurance starts to pay. But for that, I pay a low monthly fee every month to have access to that insurance product. Or I can have a low annual deductible, but I pay more monthly for access to that. And, you can look at it based on the fees and where you are in your life and decide for your own what sort of structure you want to have around that product. The third thing is it creates a patient liability, regardless if you have a small deductible and use it up or a large one. There is what we call the self-pay after amount. So if you're paying out of pocket, there is a liability or a patient remainder that then gets billed to you. And this is viewed in a weird way as a good thing. It produces consumerism because we start shopping, we start paying attention to where we're going to the doctor. We want quality and price to match up. And so it creates a lot of different challenges, and to go back to that theme earlier, that are opportunities for entrepreneurial minds to try to go solve for and build companies around. So that's kind of the 1, 2, and 3 of the problem. Any questions there? Is that clear? I know it's very different in the way that you see the world from what the patient owes on a daily basis for their health.
No, yeah, that makes much more sense. So we are spoiled over here because at the moment, obviously, we don't have to worry about anything like that. But I've got a feeling that might change in the future. But that's another podcast. But no, I'm with you on that.
And so, when you think about the complexity here, people can go to the doctor and they don't know if it's going to cost them $20, $200, or $2,000. Or we can put that in euros. And so, that's the challenge when you talk about transparency. There's products that solve for that to help people understand that. And knowing what that might be, then you're more prepared when the bill comes. The other problem is, number of bills. I started this company with my co-founder back in the day when my wife went to the hospital. We had a great clinical experience. And my daughter was born, Eleanor was born. We came home from the hospital. People started showing up, knocking on the door, wanting to wish us well. And then someone else showed up and knocked on the door. It was the postman. And it was one bill, and that was followed by another bill, and another bill, and another bill. And I didn't have good clarity or understanding where all these were coming from. When did it stop? What my insurance was supposed to pay, if it was right or not. What they shouldn't pay, when I should pay. And then you get to the third piece of this is around kind of the affordability issue. If it's over $1,000, people are going to really think hard before they pay. If it's under, $1,000, you might look to a payment plan. If it's under $100, you might pay immediately. But this all stacks up into a lot of confusion. And where there's confusion, right, there's opportunities to streamline that and make it better for the consumer. So that is where I had this aha moment, and I told my wife, and this is why she is so wonderful. And I know before we started this, we chatted about this. She grew up 8 years over in England, so maybe that has something to do with her being funny and understanding. But I said, just give me a year to try to go out there and find a customer to create some product market fit. Our first version of this product, which we call a MVP, minimal viable product. And let's see if we can get someone paying for it. And so we started with a simple problem to go solve for out of all that complexity. And from that, we've been building forward every single day.
And I would imagine it must be incredibly concerning for a lot of people out there, especially during a global pandemic, because things like ventilators and intensive care treatments and things are going to be incredibly expensive, aren't they?
Yeah. And again, you don't know what those may be. Now, fortunately, we've got a great government. We both have great governments. And I always say, all you have to do is leave our countries and come back to know sometimes, despite all the things we complain about how great they can be. But our government stepped up and said, look, if you're going to the hospital for a COVID-19 issue, you're not going to have to face the patient liability piece. We don't want you to not go to the hospital or to put off care because you can't afford it. So that's a theme we see within our public policy debates a lot today. But there still is big issues around that, because if you go in, you may find out that you have high blood pressure, and so you got to go down a different path. Or you might find out, you need this or that or the other. And so that may not be covered under the COVID-19 plan. And therefore, someone leaves and they are on a plan to get well or to stay more healthy, but they are going to have some dollars that they owe the hospital. And if I were just to stop for 1 second and swing this problem around and look at the Coke bottle kind of from the other end, all right, I'd say this. If you're a CFO in a hospital here in the States, and suddenly 5 or 10 years ago, you didn't have to worry about deductibles. Insurance paid most of what was your revenue, whether it was the public payer, we call the payer the insurance company here, or the private payer. They accounted for 90%, and the other 10% of your revenues, if you didn't kind of get them in, it was so what? I'll get 5% of that. I don't want to send the other 5% to collections and create a bad experience for my consumer. But now, with the advent and emergence of deductibles and all these, the patient liabilities increase more, you as a CFO suddenly wake up and realize that 20 to 33% of your revenue comes from the patient. And you don't have technology designed that was built from the ground floor up to communicate to patients, to help them understand, to help solve the affordability issue, to make it easy to pay, to track, and have good clarity around what all that means around that part of the patient journey.
And I'm curious, how can technology combat some of these problems that we've talked about here? I mean, you've done a great job of setting the scene there and how some are obviously struggling. But if they were to put your solution in place, how are you using technology to combat those problems directly and bring them into the 21st century?
So that's a good question, because there's always people that are going to see problems and try to pounce on them, whether they're new upstarts or they're gigantic old companies that just can't turn the ship fast enough. Yeah. We're certainly the former, not the latter, and we can beat people on speed. The existing people that are servicing healthcare systems today, they're used to taking a data feed and sending it to an insurance company, receiving a denial request or acceptance request, sending that back, and then eventually sending payment with that claim. What they've done is they've turned that technology, as the emergence of the patient liability started to increase more and more, they've turned that technology, swiveled it, if you will, to send those same types of file formats to patients here in the States. And therefore, you get things like CPT codes on your bills that you don't understand. We fixed that. You're going to get a bill that has claims dollars in terms of debits and credits. So it looks like an accountant built it. Again, it's more of a B2B transaction. We fixed that. It looks more like it's B2C. We can communicate to patients in their own ways of their preference. So, Neil, you might like to receive text messages. My mom still might like to receive a bill that's in extra large font size. My wife might want to receive a e-bill with a predetermined payment plan based on her past payment preferences. So we customize all these communications. And it's very much like if you and I, Neil, went to the hospital today in Atlanta, Georgia, and we went inside the ER, they would treat us very differently based on our medical records, based on what medicines we're taking, blood types, things that we're allergic to. The list goes on the clinical chart. My question has always been, why don't we treat people differently on the financial charts? Because we all buy and pay for things differently based on tendencies. And if we can start to understand those, then we can communicate to consumers in their preferred way, and that leads to faster payment. And then the last thing that we really fix that's unique, if you bring in more payments to that CFO, that's a good and bad thing. Suddenly they went from not receiving a lot of payments to receiving a lot. Imagine someone dumping wheelbarrows of money off at your front door every day. You would have to create teams of people to sort it, to put it in the right piles. And because of some regulatory aspects over here, to make sure that the PHI or patient health information is protected, to make sure it's done in a compliant way that's PCI compatible on the payment side. And you got to mix all that together and then go back to that specialized EMR, electronic medical record, that has a patient accounting system in it and posts all these data points clearly without any human intervention, and then deposit those monies to the bank account. So as a payments company, we solve for a lot of that problem as well. And when you put it all together, it's one platform that's so easy to work with. Patients love it. Health system employees love it. Everyone's on the same page. And suddenly, in that last bill, the bill that you get after a great clinical experience isn't so bad. And I like to say the last touch isn't the worst touch. Suddenly, it's just as good of a touch as that great communication you had with your doctor to help get you well.
And when I was reading about you before you came on here, another thing that makes Patientco unique is how you're tackling many of these problems by using analytics. Can you expand on that for people just hearing about you for the first time?
Yeah, I mean, we read a lot about analytics, I think, in the world today. But the question is, what do you do with the analytics? And so our challenge is, how do we learn? We talk a lot about this at Patientco. How do we not just learn about what's going on in the environment, but how does our technology learn the preferences of our end users? And then based off of that, we can determine the best path of care. And, we think of care, clinical care, but the best path of financial care. Okay, so we can start to take analytics. Let's say someone's checking into the hospital and we see that they qualify for charity care. On the back end of that visit, when they left the hospital, why do we send them 3 or 4 bills, and when they haven't paid, determine, let's put a charity care application in the mail to them and see if they'll sign up for that to get a payment going? We got to realize right off the bat that they qualified, pass that data down, and the first communication we do to that individual is to see if we can sign them up for charity care. That gets the health system paid faster and gets the habit going of someone making a small but important payment. So analytics are used, all over in lots of different scenarios like that to try to make this patient financial experience that much more, and I like to use the word delightful, and done in a way that we can combat the problems that we talked about and create outcomes where more payments are coming in the door at a lower cost or a lower cost to collect.
I'm curious, as someone that's an entrepreneur who's striving to make the patient financial experience an economic growth engine for health systems, where did that idea come from? What inspired you to go out and solve these problems? Because I got a feeling that there's got to be a story there somewhere.
Yeah. Well, I mentioned earlier about the healthcare experience, and we came home from the hospital, and there was my daughter, Eleanor. And that is a true story. That's something I tell. But I'll tell you the real backstory that I don't tell, if you promise not to tell.
I promise not to tell. Just,
No,
just me and you and people in 165 countries.
That's right. No. So my first company, BroadSource, I got really curious about, so from a telecom expense management perspective, we were actually helping people manage and track and understand their telecom bills if you're an IT director. But inside of all that, obviously we had a business to run and we had a controller. And so she'd go to her computer and she'd type up an invoice to send it to a supplier, and that was electronic. And then she'd print it off, and she'd tear it out of the printer, and then she'd put it in an envelope and put it through the mail. And then let's say you were the recipient, you might get it, or one of your listeners, and your listener would open it up, type it into their computer. It's electronic again. It'd sit there for 30 days. Then it was time to pay. They'd go back in there electronically, print up a check. It goes to paper, go put it back in the mail. It comes back to her. She'd open it, right? And she'd put the check on the side, and then she'd go in electronically and mark it as received. And now we know we've been paid, but we now have to go through the banking network to move the money. So she'd take the check, walk down to the bank. If she had 10 checks, right, for $100 each, that's $1,000. She'd work with the teller to make a deposit of $1,000. That teller would give her a bank receipt back in paper, even though the teller was scanning the MICR and the bank account routing number all on the other side, and then entering that information digitally. And then we would come back to the office, and we'd sit and wait for those 10 checks to be deposited, because the next process would occur through the ACH network here. You'd go retrieve the dollars from all those 10 bank accounts and then put them in our bank 2 days later for $1,000. And once she saw that deposit had occurred, then she can mark those checks as all paid, and the process is over. But it's a lot of electronic and paper conversions, right? And I started thinking, what if the dollars and the data all flow together? Wouldn't it make it more simple, where she just almost sees her online banking account and hits click, and it deposits all that back to the QuickBooks application, and she doesn't have to do any of that reconciliation, much less all the other stuff that we talked about. So that was in my head, and it got married up with this experience of my wife having the baby and receiving these complicated, hard to understand bills. And it was like, oh my gosh, here is a really convoluted process around billing and payments that can be applied to something that's growing, which is healthcare, with the patient deductibles that's only getting bigger and bigger and bigger. And I think I'm not the only one that faces this problem. Everybody who goes into a health system faces it. And so if you're doing a good job and you're getting people to pay more through a technology solution, that complements the backside of it. Because if you get more payments, that's a lot more work you have to do to reconcile all that. So back to our account at BroadSource, if she got 10 payments, that's great. But what if she got 100? It's 10 times the work. Technology can automate that. And I just felt like we had a really good win-win here that was unique. It was good for hospitals, and it was good for patients, and it worked. And we could go build off of that and grow, and so I was very inspired by that.
And I love how you found that entire process overwhelming, and then it actually inspired you to go away and create Patientco to make those healthcare payments easier and more convenient. But I'm curious, what were the biggest challenges that you then had to overcome to deliver that success and solve that problem? Because I'm able to imagine there was a lot.
There's a lot. I mean, that's a whole series of podcasts. I mean, there's raising the money is hard. That was a big challenge. I think anytime you're dealing with payments and reconciliation of those payments, I mean, we forget because of the fraud element in payments. There's a lot of compliance around that. Building technology in verticals that require a lot of need around compliance is hard. And you combine that, it's not just payments, it's healthcare as well. There's a lot of compliance around there. Patient health information has to be protected. PCI compliance on the payment side. And by the way, we are helped in that aspect. Did you know that a lot of these credit card transactions come through the United States? So there was a 70%, by the way, of all the credit card transactions come from the U.S. But my point here is when you have technology clusters, you have people who understand things, the details around them. So that was one challenge that is big, but we were able to overcome that just by being in Atlanta, Georgia. And I think another big challenge is when you're building enterprise-level technology, it has to be on all the time, every single day, day and night, 365, 24/7. And when you're moving payments, you can't afford to have a mistake around moving a dollar, or you're going to lose the confidence of your customer. So those are all big challenges. I think certainly, large health systems aside, and we've got some of the largest health systems in the United States here on Patientco, the COVID-19 pandemic is certainly impacting everybody, but especially the healthcare industry, because 50% of the hospitals are shut down. I mean, all elective surgeries are being postponed, and no one really wants to go to the doctor's office right now. They don't want to catch anything. So I think COVID-19 has kind of highlighted for us the importance of offering a lot of compassionate care for patients, not just on the clinical side, but on the financial side, and that's something that we're passionate about.
And for any startup founders that are listening, that are somewhat inspired by your story, but they're at the very beginning of their journey, is there any advice that you would pass on down to them? Anyone that's got an idea or just thinking about making their own leap? What are the biggest lessons you learn?
That is something I'm passionate about, because you find out so much about yourself just as an entrepreneur. I mean, it's a very worthwhile process, and I think that has a lot of dividends that you can find ways to give back to people if you build something that other people can use and benefit from. The way you get there is you've got to listen to your customers. You've got to. I mean, every entrepreneur, go study product market fit. Go understand what your ideal customer profile might be. Go look up your MVP, minimal viable product. Go understand, the challenges around raising capital so that you can fund that growth. There are lots of different ways to grow businesses, by the way. Not all of them require capital. You could go get a bank loan. You can just grow it based off the revenues that the business has. I think the other one that is important for me that I've learned is I mentioned earlier about growing yourself, but the way you really scale a business is helping other people grow, and you've got to empower them to grow. People want to be there to make decisions. They want to be held accountable. They want to understand what success looks like. But you don't need to have control over every decision in your company. Let good people understand what success is, how to get there, and turn them loose. Because growing and building a business is inspirational in its own way. And when you get a lot of people together, they're starting to click because they trust each other. High trust is essential to growth. High trust teams produce high quality results. You'll be amazed at what you can accomplish together.
And a question I've got to ask as we look towards the future is, what excites you about the role of emerging technologies and the kind of changes that they could bring and help Patientco evolve too?
Yeah, that's a really good one also. I love emerging technologies when they make life simple. And so, we have a saying around Patientco, we like simple. There's so many things that are complicated in life. To every entrepreneur or potential entrepreneur or product manager out there who's listening, think through things that are complicated and see if you can simplify them. Nothing's impossible, everything's possible. But if you just wrote down the street every day and create a mental or physical book of problems that were complicated and that you could help solve for, you'll be amazed what you start to write down. And some of those can be tied to research through universities. Some of those can be tied to, there's so many easy ways now to go get a server in the cloud, build some code, get some testing done with customers to see if they like it or don't like it, and turn it into a real product that if you continue listening to your customers, you'll be amazed at what you can solve for. And so that's how industries get born. That's how companies start to transform our lives into something that is easier and better than what they were before, because we start to adopt it and we start to use it and we start to talk about it. And that's when I think, technologies and emerging technologies can become innovative and exciting.
And again, looking to the future, what's next for Patientco? I understand you probably can't share too much about the future and what you've got planned there, but is there anything you can leave us with today?
Yeah, I mean, look, the states have a great healthcare systems. I mean, great doctors, great nurses. They do a good job of treating people for a lot of acute illnesses and helping them manage through that and getting them well or to a better spot. But with a lot of the complexity that we talked about previously on this podcast, it's hard being a patient in America. It's complicated. Understanding how to navigate that is really tough. And I'm not just talking about which hall do you go down. It's in the hospital. It's hard to be a patient. And we get really passionate about helping patients navigate to the best ability their financial and clinical care. And you will continue to see us go down and make healthcare here more humanistic, so that everyone has access through the tools and technologies that can empower them to understand how to manage their own care. And I think as we do that and we get people using healthcare more, we're going to solve for an even bigger problem that's being caused today, right now. I just read one of our customers in Birmingham, Alabama, a big healthcare system there, is projected to lose $70 million per month over a lot of the restrictions they've had, like canceling non-urgent care that were put into place around the pandemic. And even big brand names like the Mayo Clinic has had to furlough or reduce a lot of hours of almost half of its staff. So by helping people use healthcare more and not put it off and embrace it more, I think we can help bring those health systems more revenue, because they're a life source for the communities as well that we all live, work, and play in. And I certainly get passionate about making sure these health systems are financially viable in the future as they help us live and enjoy all the great things of life, like having a great beer at a pub on a Sunday afternoon in England.
I'll drink to that. And before I let you go, can you just remind everyone listening of where they can find you online and equally contact you if they've got any additional questions about the conversation today?
Yeah, please come check us out at patientco.com, and that's P-A-T-I-E-N-T, just like patient, P-A-T-I-E-N-T-C-O.com, or send us an email, learnmore@patientco.com. We'd love to trade notes, think about where healthcare elsewhere is evolving, how technology can be scaled in different regions and different corners of the wonderful planet we live on. And cheers to you and all that you're doing to help share a lot of knowledge. Knowledge is power, and helping people get better each and every day around solving for some really cool, innovative problems out there that need cool solutions in our lives. So great to meet you, and thanks for the questions and interest around Patientco.
No, I absolutely love chatting with you today. I think it's a great story that you've shared about entrepreneurship, using technology to solve real world problems, but with that very human story at the heart of everything. So I've loved chatting with you. It'd be great to chat with you again in the future, but more than anything, just a big thank you for joining me on the podcast today and taking the time to share that story. So thanks again, Bud.
Well, thanks so much. Nice connecting with you, and take care.
I love how Bird came up with the idea for Patientco after he and his wife had their first child, and subsequently they were flooded with bills from several different providers. And I suspect that kind of scenario is something that many people listening would have experienced. But Bird found that process to be overwhelming and actually created Patientco to make healthcare payments easier and more convenient for other people. So I cannot thank him enough for discussing issues related to billing in the healthcare industry and how technology can be used to combat those problems, not to mention revenue cycle management in healthcare and the actual benefits of telehealth and how Patientco is using analytics to create a superior billing experience. But also for sharing the very human story at the heart of it all. That's what makes his story stand out for me. So a big thank you to Bird for being incredibly patient during a few tech hiccups that we had during today's recording, and also inviting me to Atlanta and having a nice cold beer watching an NFL game. And let me tell you, Bird, I'm holding you to that one. We will make that happen, assuming I will be able to fly and enter the US in the near future, of course. But for everyone listening, let me know what you thought about today's interview. You can email me, techblogwriter@outlook.com. My website is techblogwriter.co.uk. Keep your messages coming in, and I'll feature you in a future episode as well. But that's it for today's episode, so a big thank you for listening, and until next time, don't be a stranger.
Thank you for listening to the Tech Talks Daily Podcast with Neil C. Hughes. Remember, technology works best when it brings people together.